The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your call on anything you'd like to talk about your health, as long as it doesn't include, my directing you to drugs and surgery. Give me a call, 888-630-9625, 888-630-9625. Listen, at the end of the day, your body has this amazing ability to turn itself around and heal virtually anything that takes place. As long as you're still breathing, you have all the parts, and that's what we want you to know as we go through the program, not only today, but all the programs that we've done and in the past. And by the way, I was asked the other day, if we want to go back and listen, do you have any programs? Oh my gosh, do we have programs? Go to roselleradio.com. That's ROSELLE radio.com, roselleradio.com, and you got hundreds of programs, and they're by dates, and you look up and you say, oh, this one's on headaches, this one's on allergies, this one's on, and just go and listen. They're there. You can, send your friends to the site and get it done. But anyway, we're here for you today, right? So we're going to go through a whole lot of different things. Second half of the program, we're going to talk about this thing we lovingly call the 21st century disease. And I think that all of you are going to be interested that it affects all of us. And it's just a matter of degrees and how fast before you succumb to the consequences of this very problematic situation. So make sure that you stay tuned and join us going into the second half of the program. It's a very interesting application. First part of the program, we're going to talk about whether pain causes heart disease or heart disease causes pain, or it's a combination of both things, and the electrical fields that are involved in that and the neurological pathways. But more importantly, what you can do about things, like when your heart starts jumping around in your chest and misfires and you have this pain, that you think might be a heart attack, and suddenly your doctor puts you on all kinds of things that, like from Toprol to aspirin to blood thinners, statins and so forth. And the list goes on. And they all have very interesting side effects that are the same things that you're trying to avoid by taking the medication. There was a program, I think, goes back now, Sue and I attended a couple months ago. There was a very interesting cardiologist by the name of Dr. Jack Wolfson, and we were there for a conference on cardiovascular disease, and Dr. Wolfson made the statement, from the podium. This is a guy that was doing all kinds of medical intervention until the light turned on, and he went into what we call functional cardiology, or the natural community, and he said that if you treat AFib, atrial fibrillation, when there's no underlying disease process, you will end up causing the conditions that you're trying to treat. That most 99% of all atrial fibs should never be treated with medical intervention, that there's other ways of doing that. And we're going to talk a little bit about that in the program this afternoon and try to get you to understand that, the term AFib, or even other arrhythmias of any kind where the heart's not firing the way it's supposed to, there is a reason for that. So let's take this heart thing, this thing that many of you are taking a whole bunch of medications to try to prevent certain onslaughts of end up symptomological things that might scare you into believing that you're going to die. So this heart, this little organ system that's about the size of your fist, that sits in the center of your chest, slightly off to the left side, has neurological intervention. It has nerves that go to it. You remember that old friend of ours, the wanderer, the vagus nerve, the cranial nerve? It goes all the way down and it touches that. And then we have nerves from the spinal system that goes to the heart. And then we have the intrinsic electrical system within the heart called the pacemakers. Now, we've talked about that before in the past, but I want you to get the idea that this heart is affected by many things, and we have to understand that in the case of the heart, we're really truly looking at the triad. We're looking at the neurological pieces from the structural components. We're looking at the biochemical pieces, all the things that make the heart operate well because it needs its fuel. We'll talk about that today. And we're talking about the emotional stresses that can cause the heart to misfire, that can cause it to go into all the things that we're talking about. And stress is a killer, right? Why? Because it causes all the things that we want to prevent. So clotting the arteries, misfiring of the heart, ultimate heart attacks, things of that nature. The valves of your heart, they don't close the way they're supposed to anyway. So there's reasons for that, but we really need to understand why the heart begins to misfire, get tired, go out of rhythm, and ultimately begins to cause our life to be shortened than where it should be. So, let's take those concepts. And by the way, please give me a call at 888-630-9625. I'm happy to give you another thought process relative to what happens with all this. So, what's an arrhythmia? Arrhythmia of the heart is really just a misfiring, right? It's not working. It's an arrhythmic, an abnormal beat of the heart. The rhythm can be too fast, too slow. It can be irregular. So if it gets, cranked up there and it's beating way faster than it should, your heart on average should be somewhere in the neighborhood of, if you're a trained athlete or you have a genetically predisposed low heart rate, you might be in the 50s. And there are some athletes that are super trained that they can, and through meditation, by the way, that you can slow your heart way down, even to 48 or 50. And some of you get cranked up and you're sitting there at 90 all the time or 95. And that sort of tachycardia, that increased rhythm beyond normal, is something that has to be answered by why is that? Why is that going on to begin with? What's going on in the body that's causing that? So the heart is this little organ system that is susceptible to all kinds of strains and stress of environment and the external and internal environmental patterns. So let's pull it apart a little bit. Our arrhythmia, your fibrillation, your AFib, if you will. That's the most common type of misfiring or arrhythmia that exists. It's usually rapid, it's disorganized, an electrical signal, and it causes the heart's upper portion, the upper chambers, the atrial areas. And by the way, the heart has 4 chambers, right? It has 2 atrium and it has 2 ventricles. And it causes it to kind of fibrillate or vibrate abnormally in a way that now the heart can't pump blood the way it's supposed to throughout the body. And then medical people get really crazy because they think just because of that irregular heartbeat, there's a pooling of the blood and you can end up with clotting and so forth. Tachycardia simply means that the heart is irregular and beating way too fast. In a bradycardia, brady means slow on the bottom side, and that's just an abnormally slow heartbeat. Somebody who is in their they get a little nervous if you're in your 50s, but not necessarily so. Again, that could be a genetic pattern that's normal for you, but you have to look at it from a lot of different places. And things like echocardiograms would show that, or a stress test on a treadmill, and it comes out in the wash, so to speak. And then you get things where you have the lower chambers, the ventricles, and they start misfiring. When the lower chambers of the heart beat too quickly or too slowly, you have a misfire. And see, these 4 chambers got to coordinate. They have to regulate. One has to contract and the other one has to relax, and they push blood through the lungs and back after it receives oxygen in other places. So, that's the skinny, the thumbnail, if you will, on abnormal arrhythmias. And, the interesting thing is that all these things are on the rise. There's more of them. Arrhythmic patterns today have been diagnosed more commonly, more often than any other time. Why is that? Why is it that we're starting to see problems now that we didn't see before, particularly with the heart? I thought we were supposed to be evolving into a stronger species. Well, I think it goes to lifestyle. It goes to the things that we're ignoring, the things that we're not paying attention to. And in this situation, we're looking at all the neurological inputs. We're looking at the nutritional aberrations, meaning things that we should be eating that we're not, or things that we're putting into our body that really shouldn't be there. And the effect goes to a couple different organ systems. We're going to talk about 2 of them today. We're going to talk about this organ system. We're going to talk about another one in the second half of the program, both affected similarly by any kind of stress patterns and nutritional stress patterns and injury to the body. The heart is affected by impact and injury to other places other than the heart. You know, when you're horsing around and you get a blow to the head, when you're playing with somebody or you overreach or you pick something up and you hurt your structural self, those nerves that go to the heart now misfire. The communication neurologically, the communication neurochemically is no longer what it should be. So subsequently, this muscle, this heart, this fist-size organ system in the middle of your chest can't operate, can't do what it was meant to do. And suddenly you go in, you have a physical, or you feel this little misfiring in your chest, and your doctor says, well, you have, an arrhythmia, and we have to fix that arrhythmia. So the first thing they're going to do, God forbid that your blood pressure is up a little bit as well, then they're going to give you something for your blood pressure, they're going to give you something to regulate the heart, then you're going to give you a blood thinner, then you're going to give you a statin, because, if you're at a certain age, whether or not you have a problem with your lipids, and that's a whole different topic we can get into, they're going to give you those things. Now they stack on top of each other. Here's the problem, and again, this is just one of the little problems of doing all that. You have a heart that's not working the way it's supposed to begin with, and now they're giving you all these things, and one of the things that a statin particularly, or aspirin as well, will cause is depletion of a very important substance, and that's coenzyme Q10. CoQ10 is responsible for the regular firing of these little engines called the mitochondria that are very heavily concentrated in the heart and in the brain. So when you deplete that, guess what you're doing? You're causing your own problem. That's why Dr. Wolfson said if you end up treating fibrillation problems with medication when there's no underlying disease, you're going to cause the problems that you're trying to prevent. Because if you don't have enough CoQ10, or if it's depleted dramatically, one of the unfortunate side effects is death. The heart stops. It goes into a fibrillation pattern, which you're trying to prevent, and it stops on you. So unfortunately, this assessment is one that we often observe in older people. So when older people drop dead from, cardiac failure or afibrillation, we have a tendency to say, well, it was old age. And so the statistics don't bear out a lot of what we're talking about, because it must be because the patient's older, even though that they've been on this garbage, if you will, for a long period of time, and now finally it's taken its toll. 888-630-9625, that's how you find me here. And by the way, when I'm not in the office and you'd like to get a message to me, go to RoselleCare.com. That's RoselleCare.com, RoselleCare.com. Send me a note. I do answer. In addition to that, if you'd like to have immediate feedback, if you'd like to get to one of my doctors, all you have to do is call the Roselle Center for Healing in Fairfax at 703-698-7117. That's 703-698-7117. And tell my staff that you'd like to have one of our guys call you and tell them what it's about, so they can, prep and be ready and make sure that they give you some good information and tell you whether or not things can be done. But this heart problem, we're going to talk a little bit more about it when we come back after the break. But arrhythmic patterns are correctable. They're fixable. Remember, we're looking at a couple things here. We're looking at the nervous system and how it affects the heart, and we're looking at things that affect the nervous system. We're looking at neurochemistries and how these neurochemicals cause irregular contractions and firings of the heart as well. So think about that until we come back after this very short break. We're talking about the heart, and then we're going to talk about the 21st century disease process that you all are involved in. Don't go away. This is Dr. Tom Roselle. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I'm in studio. Call me, 888-630-9625. That's 888-630-9625. Talking about the heart, and we're going to talk a little bit about a 21st century disease in the second part of the program. The heart is this fist-sized organ in the middle of your chest that's connected by all kinds of things. Nerve from the brain called the wanderer, the vagus nerve, the nerve from the spinal system, nerves from, and also the pacemaker. We had a caller that didn't want to go on the air but asked a question. Am I talking about the ventricles, or am I talking about the atrium when it comes to fibrillation? Both. We're talking about arrhythmias, and when you can't distinguish one from the other. The only way that you distinguish them is the upper chambers, the atriums are fibrillating, so you have an AFib, and the lower chambers, if they misfire or start, not doing what they're supposed to do, and they start fibbing. So you can have premature ventricular contractions where the lower portion of the heart, the ventricles, contract either too soon or in a latent stage, if you will. They're missing their signal. And so what we look at is, where's the signal coming from? And we just said the signals are multidimensional. They come from the structural components. So if you get hurt, if you get a blow, if you get a trauma to your body, it can upset that signaling, if you will, and cause it to either be too quick, too soon, or in a latent situation, way, way late down the line, so you're not getting the contraction that you need to have. So one ultimately, by the way, can feed into the other. So the other thing that you need to look at are the nutritional pieces that affect the heart. And, we talked about the different types of medications, that if you're taking statins or aspirin or toprol to try to regulate the heart, if you're taking blood pressure medication, they're all going to have an effect, and the effect, unfortunately, is going to be some of the things that you want to fix. There are certain things that you want to pay attention to when it comes to nutritional needs. And across the board, there are things that allow the heart to regulate properly. So things like magnesium and something called L-taurine. It's an amino acid that has a very specific impact on the heart, but also potentiates antioxidant formation and so forth. B12 is critical as well. And we talked upon CoQ10. You want to increase nitric oxide formation so the heart is getting as much oxygenation and circulation as it possibly can. Things like arginine, L-leucine, grapeseed extract, things along that nature. But, you just don't go out and buy the stuff. We can even get into things like alpha-lipoic acid, specifically carnitine. Carnitine will help regulate the heart. Vitamin E. They're all for very specific, but we want to deal with rhythmical contraction. We have to make sure that the heart has enough magnesium, it has enough taurine, it has enough CoQ10. So those things are important. Diet, obviously, is critical. When, if we want to do it dietarily, we're going to look at things like increasing levels of omega fatty acids, the DHA forms. That contains your omega-3 fatty acids, and that helps cellular control of cellular inflammation. So if the inflammatory levels are too high, then it affects not only the chambers of the heart, the muscles of the heart, but it also affects the vessels that supply it. Our old friend garlic. Garlic is an amazing impact relative to sulfur compounds and how it affects normal blood flow and blood pressure. Beets are great in their ability to open up circulation to all tissues, but particularly heart tissue and brain. So there's things within nature that we know that can be supportive. And, my brain goes to, why wouldn't you do that first? Why wouldn't you go there before you tried anything else? Make sure that you get the sugars out of the diet and the grains out of the diet. And, many people are sensitive to coffees. So, why can't I do decaffeinated coffee? Well, if you have a decaffeinated coffee, there's this thing called methylation as how they decaffeinate it, and it has an effect on pancreatic function. We're going to go to the phones very, very quickly before we go to the break. Betsy, how can I help you?
Yes, sir. I have a brother, and he is 70 years old. We have heart disease runs in our family, and in 2.5 weeks he was taken to the hospital for like chest pains and feeling like indigestion. They've done CAT scans, they've done heart scans, they've done MRIs, everything. They can't find new blockages. They found a cyst on the outside of his heart, but they said that they cannot find any reason why he's having all these symptoms, and I didn't know if you had some kind of a test that they might be missing.
Sure, absolutely. A couple of things. Let me ask you a quick question. Is he on medications?
Pardon?
Is he on any medications? Is he on
Yes, sir. Yes, he's on acid reflux medicine for years and years and years, which I know the no-no. I'm listening to you. He's on blood pressure medicine. He's on cholesterol medicine, and they're saying that he's on the borderline of being a diabetic so they're starting to treat him for that, and they have him on metformin, and I don't like that.
Okay, so Betsy, what I'm going to do, we're coming up to the break. I'm going to hold you over because it's a really important question. So I'm going to simply say before we get to the break that all of the things that he's on right now can cause the problem, every one of them. And compounded, as I said earlier into the show, ultimately can cause his heart to go into failure and stop working. So let's hold that thought. Don't hang up. I want to keep you there, and I want to talk about it a little further because it's a very important point that you're making, and I want to elaborate on it a little bit because there's too many of us out there that are being put on things that we shouldn't be put on to. So don't go away. We're coming up to that halfway portion of the program. We got a very interesting question online. We'll be right back. Don't go away.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. We're talking about some very interesting problems, and we're starting with the heart today. And hopefully we're going to get into that 21st century disease, but there's a whole lot of you who want some answers. So we're going to try to take them as best we can. But we're here at 888-630-9625. Betsy, are you still there?
Yes, sir.
Okay, great. So, we have a problem with, a 70-year-old male who has some discomfort and pain, and they're looking at the heart, but they do all the testing, and there's nothing wrong with the heart or the circulatory patterns and so forth. Am I correct so far?
Yes, sir.
Okay, good. So here's the deal. If they start putting him on, and I asked you, is he on medications? He's on a statin, and he's on going blood pressure medication, and all these things. That's a normal cocktail that they put, unfortunately, many geriatrics on, and people who complain about all those things. If you listen to the program in the past, here I am, and practicing for 40-some years, and every couple of years I go get a treadmill exam just to know how far I can push myself because and I don't take medications. My blood pressure is about 116 over 68 most of the time. And they wanted to put me on a statin and an aspirin every day preventatively. And I looked at this wild man in front of me and I said, you got to be kidding me, right? And I won't tell you everything that I said to him. But the bottom line is everything that they're trying to put your brother on is going to cause the problems that they're trying to prevent. And what you need to do with this, you have to remember that the heart can't feel pain. It can only refer pain into different parts of the body. So it can go into the arm, to the chest, and the jaw, and back, and so forth. But it doesn't mean that the heart's a problem. It can simply mean that the heart may not be firing correctly. It could be the nerves that go to it, the vagus nerve from the brain. It can be the nerves from the spine. The heart needs magnesium, and it needs lots of magnesium.
I suggested magnesium, sir, and everybody thinks I'm in Lulu land.
No, it's one of the most important components. You have to balance magnesium, potassium, and even some sodium within the heart to make it work properly. You have to make sure that the neurological pathways are open and firing properly. But for heart health, at your brother's age, he can't get hurt by taking coenzyme Q10, and I would take at least 100 milligrams a day. He wouldn't get hurt by taking magnesium, and the only side effect of magnesium, if you take too much of it, is diarrhea. And so you back it down. You take it back down. But every organ, every cell, every tissue in the body needs magnesium. Now there are many different types of magnesium, and just across the board,
how about the chelated kind?
The chelated is just all that means. It means it transports. It's a chelator. It rebinds it and transports it in a different way through the small intestine. But if you have a blood pressure problem, magnesium aspartate is a good one. Across the board, generally for muscle tissue, magnesium glycinate. There's a citrate.
Did you say magnesium glycinate?
Glycinate. Or you can get a combined form, but go to a health food store and get a good brand, one that they can tell you that is, hasn't had a lot of garbage in its processing and so forth. So start with that. But I would encourage you, that if he doesn't have any disease processes, that this shouldn't be treated with medication. Between acupuncture, chiropractic manipulation, good nutrition, dietary patterns, you can resolve the majority of what's going on. So, we can get in much more about this. I don't know enough about him. I'm not his doctor, so I can't give you specific recommendation. But if you want some more, send me a note. Go to rosellecare.com.
Can you I have a test for magnesium, a blood test?
There is. You can get a serum test for magnesium, but even with that, you may have some within the margins within the blood, but if it's not enough transporting, the pool that's sitting there is not going to show aberration. So, for example, the upper ends of magnesium is about 2.2 to 2.4 on most laboratory tests. You want to be within that upper threshold. Magnesium can't hurt you, but I would start with that before anything else. Betsy, I appreciate your phone call. Send me a note at rosellecare.com and see what we can do relative to that. Bill, how can I help you? Thank you for calling.
Yeah, I'm about to see my third cardiologist, and the two previous cardiologists never spoke of CoQ10 as I just heard you do.
Yes, sir.
And I don't understand that. I discovered CoQ10 on my own, and when I mentioned it to my second cardiologist, he kind of had this passive, like...
It's like really he doesn't know. Okay, so here, let me explain that to you. And unfortunately, you're dealing with traditional allopathic community. They look at the organ itself, and they want to fix the symptom without asking the question, where did it come from? Why did it start? And, it's the same thing with cholesterol. For example, cholesterol is not an enemy. It's your friend. But when you do the traditional cholesterol test of total cholesterol, triglycerides, HDLs, LDLs, and then you do a ratio between that, it doesn't tell you anything. The bad guys, the LDLs, the low-density lipotropins are broken down into really bad guys and not-so-bad guys. The good guys, the HDLs, the same thing. They're really supportive, and there's some that are not supportive. So you've got to know the difference. So here's the unfortunate truth about so many things, is that they're going to throw medications at things, and they're not going to try to figure out what the problem was that got you there in the first place.
Well, I'm definitely on the cocktail, as you described it, the Toprol.
How old are you?
I'm 65.
Yeah, we're in that neighborhood. I'm a few years older than you are, but nevertheless, unless you've got underlying demonstrable cardiovascular disease, there's other ways of doing this, and you just have to get somebody who knows what it. You're out in Sharpsburg, Pennsylvania?
Sharpsburg, Maryland.
Oh, Sharpsburg, Maryland. I'm sorry, I'm misreading.
Yeah,
I'm looking at the board.
Is there such a thing as effusion or evulsion of the blood back into the heart so it makes you feel lighthearted?
That makes you lighthearted. You can get
lightheaded. Excuse me.
Oh, lightheaded. It's when those things can happen when the cardiac output is not as strong as it should be. So you're getting a kind of a latent phase of contraction of the ventricles, and the ventricle doesn't push. It's the left ventricle that does it, so your brain's not getting full perfusion, and you're not getting oxygenation into other areas, so you can have that experience. That's just one of the causes. So the short answer is yes, maybe. But you have to see what, how it's contracting and so forth. There's other pieces of that as well. You look at blood pressure. If you stand up too quickly and you get lightheaded, that's your fight-flight system. That's your adrenal glands not putting out enough of a hormone called angiotensin, which causes a little tone in the blood vessels as you change postures, turn your head, and so forth. Otherwise, you get that swimmy feeling, that lightheaded feeling, and so forth. That's another part of the pattern. Your adrenal glands also produce adrenaline, and today we call it, epinephrine, norepinephrine, that causes a lot of balancing within the system, but also within the heart. So, there's much.
I'm going to send a note to your office. I walk every day. I have good. My last cardiac stress test was good, and I have the inverse of the on the LDLs, the HDLs. I'm good on both of them, but I'm still kind of not impressed by why none of the cardiologists I've seen before have ever really advocated strongly for CoQ10. And your argument, I've just heard on the radio this morning, but I think I already knew it, is excellent.
Yeah, Bill, what medication? You have a stent, right?
I have a stent in my LAD, and I'm on 81 milligram aspirin, 2 per day, Toprol, simvastatin, and I take CoQ10. Yeah,
you're depleting your CoQ10 by bushels with all the stuff that you're taking. And so send me a note. I'll go back and forth with you, and I'll tell you what I would be doing if I was in your position relative to evaluation and so forth. We deal with a lot of patients nutritionally that are in your situation. But let's talk. Send me a note, and I will get back to you. Bill, thank you for your phone call. I really appreciate it. 888-630-9625. I don't know whether we're going to get into the other pieces today because there's so many of you that are calling in on this topic, and I don't want to ignore you. But let's get off topic a little bit. Ruth, are you still hanging in there?
Roselle, Dr. Roselle, can you tell me whether artificial sweeteners like Splenda lead to dementia? I think there was something recent about that.
Yeah, they're finally coming around. It's not just recent; it's been there for a long time. But a lot of the artificial sugars, or the sugar-free things, they're promoting because we have a sweet tooth. Dr. Lamp did a program in the office the other day. The number one enemy, which was sugar, or sugar addiction. And, you're talking about all these things, from sweet and low to equal to stevia, and, the list goes on, Truvia. The American Heart Association and the American Diabetes Association, they've given caution when you're using these things because they know, they get it, they understand it. So let me take it from the top. When you put anything in your mouth that is sweet, regardless if it's real sugar or artificial sugar, your body interprets it as it's being a sugar process. And so your body starts going into action. Your insulin level starts kicking up. You start mobilizing very specific forms of minerals to transport this potential sugar that's coming in. But to answer your question specifically, there's been a lot of research coming out of Boston, coming out of Stanford University, and so forth that basically says that these things can cause cancer, can cause degeneration within the brain. It's a very specific finding that suddenly that they're coming up with. It used to be anecdotal, say, well, maybe, but non-nutritive sweeteners, if you will, are far more potent in their destructive process. High fructose corn syrup can cause all kinds of inflammatory reactions, and anything that causes inflammation is going to affect the brain and neurological pathways. So knowing that, and knowing that they can cause things like cancers and so forth, suddenly, because people are being aware more so than even their doctors, you're seeing things coming out of Harvard. There's a guy by the name of Howard Lee Wine, spelled like wine, W-I-N-E. He's chief medical editor at Harvard Health, and one of their journals, I think, is Harvard Health Publishing, and they're finally slowly putting things in there. They come out and say, those studies have shown that smaller amounts of diet sodas, and they say smaller amounts, 24 ounces a day consumed by people who drink diet sodas are showing very significant impact. Long-term studies are showing it on hardening of the arteries, which is going to affect the brain. It's also going to affect the heart. It's going to increase the risk of type 2 diabetes by 67% is the number, that's out there. It's huge. And so, the bottom line is sugar is sugar to the body if it tastes sweet to the mouth. And it does have a huge impact to the brain and will cause neurodegenerative changes, and they need to be avoided.
Thank you so much.
You're welcome. Thank you for calling. Appreciate it, Ruth. 888-630-9625. We'll take one more call on the subject, then I'm going to try to touch on that 21st century disease. Keith, how can I help you, sir?
Hi, Doctor. I wanted to know how you tell the difference between a heart pain and a muscle spasm that was created by surgery to the neck. As I get a case, I had a ruptured disc that was repaired, and I still get, residual sort of numbness and muscle spasms down my left arm occasionally. And I never know. I'm like, okay, is this a potential heart attack or is
okay, so let me ask you a couple of differentiating questions. Keith, when before you had the surgery, before you had the disc, or when you had the disc and before you had the surgery, did you have neck and shoulder problems on the left side?
Yes.
Okay, so it probably is the same thing. Most surgeries do not correct the problem. You have about a 50% chance of having surgery being successful, and what that means is that it modifies the pain or takes it away. The other 50% of the time, it can remain the same or get worse. So the underlying irritation to that nerve that's going into your arm, which is the lower portion of your neck, it's called the brachial plexus. If it's coming out of C5, or the C5 nerve root, is going to affect your shoulder. It's going to go down and all the way down and affect your thumb and your index finger. And then depending on if there's other branches, then it tells you which fingers, what side of the arm, and so forth. But the fact that it was there beforehand and is still there, that tells me it's your neck. You need to have it looked at and have somebody, that does the work that I do, check it out for you. And within a very short examination process, it can be identified. And if it's something that can be treated, it can be treated effectively, and you'll get rid of the problem. I hope that helps, Keith. Thank you very much for.
I wake up sometimes and I have that symptom, and I'm thinking.
No, that's your neck. That's your neck.
Be careful.
No, that's your neck. Go get somebody to take care of it, and if we can help you, give us a call. 888-630-9625. We're going to talk about the 21st century disease process, and we're going to unfortunately not have a great deal of time because we're coming up to the 2-minute mark before the break and then the program, but I'll do as best I can. So what am I talking about? I'm talking about stress. I'm talking about adrenal fatigue. There's a whole bunch of symptoms that go along with it from, you're totally exhausted, even have a good night's sleep. You don't want to get out of the bed in the morning, premenstrual syndrome, endocrine problems, lack of libido. You can't handle stress. You react. You want to take somebody's head off. Your memory and your cognitive patterns are declining. You crave, by the way, sugar and salt. Salt is always, if you crave salt, you got to have salt. It's always an adrenal fatigue problem. And suddenly you develop this thing like you don't think much of yourself. Your self-esteem goes into the bucket and you become fearful and you have inability to get weight off, and you might become a skinny fat person. And what I mean by that is that you've got fat within the inside of the body. You have a fatigue pattern that just never, ever, ever goes away, no matter how much sleep you get, no matter what you do for it. It's one of those things that just is, but that's chronic stress, and it's definitely a 21st century disease process. All of us suffer it from one of these. Think about all the problems that you're having, from pain to heart disease to diabetes, to generally not feeling good. You're constantly tired. Your brain doesn't work. Those are all stress patterns, but when we talk about stress, we're talking about how it affects everything from the nervous system to the chemistry, your emotional pathways, and then the different body systems from, your blood supply and the removal of waste and so forth. And so we can go on. I need 2 more programs to do this, but we're going to talk about it a little bit more when we come back from the break. So you're listening to Dr. Tom Roselle Live. Don't go away. This has been a great program, by the way. Be right back.
105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live, as you do every Sunday at high noon on the Eastern Seaboard. Thank you. Thank you very much for making this program as successful as it possibly is. We're here for you. We do this program because we want to bring you the best information. And by the way, always feel free to reach out to one of the doctors at the Roselle Center, and you can do it either by online email or you can do it by phone. Give us a call at 703-698-7117 and ask staff, hey, listen, can I have one of the docs call me? I need to have a quick question. Can you help me? We're happy to do that. Or simply go to rosellecare.com. That's ROSELLECARE.com. And by the way, check the website out. We've got videos there for you to watch, and we try to change them up all the time. There's an introductory video by yours truly. Push the button. You can meet our staff online. You can see what we look like. It might be scary, but nevertheless, try it out anyway. We can say hello to you. Been a very interesting program today. We're going to talk a little bit more about this 21st century disease process, but like I said, we're just going to basically touch on some highlights. I only have a couple of minutes. But we're talking about the adrenal stress, and it ties into everything that we talked about in the first half of the program with heart disease and heart not working the way it's supposed to and so forth. Your body has a built-in stress response, and you're supposed to have stress. If we took all the stress away, every bit of it out of your body, so you sat there without any stress, you die. So stress is important, but it's the increased stress, either too much happiness, by the way, if you were one of these people that are always at the top of your game and you're going, that's a stress pattern, or the other way around, obviously. This fight-flight system, this protective mechanism, are 2 little glands called the adrenal glands that sit on top of your kidneys. And they're responsible for a lot of stuff. That's your life force in any traditional medical philosophical basis. In American sense, you have this thing that they call constitution. Somebody's got a strong constitution. That comes from your adrenal system. You have, in Chinese medicine, you have something called your shen, which is your spirit, and they correlate that to the same type of thing. So, but when your fight-flight system, your adrenal system begins to deplete itself, you find people become weak. We find people become fearful. We find people that have all kinds of other disease processes, from heart disease to diabetes, to not be able to think clearly, and it goes on. So these adrenal glands, these little guys help you regulate your metabolism. They respond to all kinds of stress. They help regulate blood pressure. And when they're dying down, they're crapping out on you, sometimes blood pressure will respond by trying to crank up to protect you, and then it goes the other way, then it flatlines on you. So when our adrenal glands are taxed, all those symptoms that we talked about originally start showing up. And this is truly a structural, chemical, emotional stressor. If we find that we live with pain and it's there all the time and we have to put up with, the adrenal system is going to get beat up. And because it's trying to compensate, it's trying to balance your body out so you don't die. If you're in an emotional stress pattern, you're one of these people that you put everything in your back pocket and you learn to live with it, so to speak, that's paramount to slowly having something erode or eat at you until there's nothing left. If your chemistry is one where you're not supporting it properly, particularly in this world where you're getting all kinds of garbage that has been GMO modified, or the gluten levels have been cranked up over the top, or you have preservatives and additives and all the junk that's in it, that's going to affect how your body functions. Those are stressors. I'm going to do a program on this one of these days. Matter of fact, I think I'll do a lecture on it, and then everybody can come and we can spend a couple hours together and really go over this stuff. But unfortunately, right now we're coming up to that part of the program where I have to say, I'll see you next week, right? So make sure you tell everybody about Dr. Tom Roselle Live, and, we'll be here for you, as always, answering your questions. Why? Because you deserve it, and we love you. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.